When a newborn is deprived of oxygen and blood flow around birth, doctors and families have only a short window to act. The condition can lead to brain injury, disability, and even death. And while cooling has become the standard intervention, there are still no approved drug therapies that directly address the underlying drivers of injury. Now today on the Russo Edge, we're looking at what it takes to bring new science into one of the most urgent and underserved areas of neonatal medicine. It's a conversation about babies, biology, risk, and the kind of leadership it takes to build a company around a problem most people may never think about until it happens to their families. Welcome to the Russo Edge. I'm Solomon Wilcots, and today we're joined by Dr. Howard Berman of ReAlta Life Sciences. Now, Howard is a scientist, entrepreneur, and company builder. He earned his PhD at Cornell University Medical School, worked across major biopharma companies, including Novartis, Lilly, and AbbVie, and then moved into building companies of his own. He founded companies, raised capital, and completed an IPO. He's even led a public biotech company, and now he has taken on new challenges at ReAlta Life Sciences. ReAlta is developing pegtarazimod for hypoxic ischemic encephalopathy, or HIE, a severe neonatal condition caused by a lack of oxygen and blood flow to the brain around birth. It is a medical emergency, and today there is no approved pharmacological therapy for HIE. Howard, welcome to the Russo Edge. Great to have you with us. How are you doing today?
Thank you for having me, Solomon.
Well, as we had that long introduction, and well-deserved because you've done a lot of work, let's get started by talking about your path. You are trained as a scientist, and you worked inside major biopharma companies. When did you realize you were an entrepreneur at heart?
Well, I think you're born with it. I believe it's innate to you, and it's something that doesn't really develop. It's in your DNA. It's you're genetically predisposed. So I knew it all along, and everyone who's an entrepreneur knows in their heart of hearts what they are all about. I like to build, I like to create, I like to innovate, and I like to solve problems that there are no solutions for.
Now, I know you said that Coya Therapeutics had a very personal origin because of your father's experience with dementia. How did that moment help to shape the way that you think about patients, disease, and urgency?
Well, my father was a triple board certified physician, one of the smartest people that I've known, an incredible person. And I thought, and I believe that anyone who would not be affected by a mind-robbing disease like dementia would be him because of his cognitive reserve, because of all of the brain synapses that have formed over the years. But dementia and the underlying processes are so pernicious and so terrible that it can actually just demolish even the smartest and the most intellectual people. When I saw my father going through it, and when you have a front row seat, it is a devastating thing to see how it affects not just him, but also the family and everyone around. We are all, unfortunately, getting older, each of us, so we all have a risk as we get older to suffer the same fate. So it's a major issue that we need to address. And I just realized that was a stimulating and motivating factor for me to really try and solve that problem. And I just had the benefit of working with an incredible physician and scientist at Houston Methodist, Stanley Appel.
Yeah. Let's turn to ReAlta now. You came into a company that already had science, clinical work underway, and investors behind it. So what made this opportunity stand out?
Well, this also solves a problem that has no solutions. This is a terrible disease that babies are starting at the beginning of their lives, and the only treatment that they have is cooling, is to put them on with a cooling cap and essentially putting them on ice, or if you will, it's to slow the metabolic rate.
Yeah.
And there is no drug approved. So I was called upon this opportunity and found the mission to be so important, similar to ALS because of the unmet need, that I just jumped right in the deep end of this. And I'm very pleased to say that so a lot of good things have happened since I joined. Enrollment's increased, the number of sites have increased, the investors have put in more capital. Everyone's extremely excited about our impending, or not impending, but our upcoming clinical data readout.
So, Dr. Berman, for people who may not know the term, what is hypoxic ischemic encephalopathy, or HIE?
So HIE is a condition that is initially an acute condition. The baby is born because of numerous reasons. The placenta may be dysfunctional in the mother's womb. It may not be delivering enough oxygen to the baby's brain. It could be over time. It could be an emergency. The cord may be wrapped around the baby's neck. The mom could be in a motor vehicle accident. And because of that, the baby is born, unfortunately, with no or limited amount of oxygen. And that causes terrible damage to the brain. It causes a reperfusion injury where the blood rushes back, and it results in a tremendous amount of inflammation that causes more damage. Ultimately, these babies either they can die, 40% mortality, and in many instances, the babies that survive have a higher rate of cerebral palsy and other developmental issues down the line. So it is a serious matter that needs urgent care.
Dr. Berman, today, therapeutic hypothermia or cooling is the standard intervention for moderate to severe HIE. What does cooling really do, and where does it fall short?
Yes. Cooling is similar, analogous to, let's say you have a sports injury and you sprain your ankle. It is just essentially slowing the amount of inflammation at that site. So that's all that cooling is doing. It's not healing your injury per se, but it is just lowering the amount of, tempering the inflammation. So that's what hypothermia does to the brain. It lowers the metabolic rate. It slows the inflammation, but it doesn't really ameliorate or relieve the neuronal injury and the underlying pathology of the disease.
So let's talk about ReAlta's lead program. In plain English, what is pegtarazimod and what is it designed to do, and why does its ability to reach the brain really matter in HIE?
So pegtarazimod is one of the most interesting compounds I've ever seen. It's derived from a virus. So this virus is called the astrovirus, and the astrovirus has a unique feature that it doesn't cause inflammation. So the drug is essentially isolating the best components of the virus, the outside part of the protein, capsid protein of the virus, that makes it really unique and is an anti-inflammatory drug. So that's what the drug is all about. It's a derived compound synthetically created from a virus, and it acts to block many components of inflammation: the complement pathway, the activated neutrophils, neutrophil traps, myeloperoxidase. These are all complicated words, but what it essentially means is it really is a unique compound that addresses many aspects of the immune system that are unfortunately are at the root of the problem for HIE.
Yeah. So ReAlta is advancing pegtarazimod through the phase 2 STAR trial in newborns with moderate to severe HIE undergoing therapeutic hypothermia. So what is the core question this study is trying to answer?
Well, we are running a trial which compares our drug with hypothermia, so it's in combination with hypothermia, versus a placebo versus hypothermia. So it's a drug versus placebo effect. We're looking at the amount of reduction in brain injury as measured by MRI. And so MRI is then taken of these babies at days 4 and day 12. And we are aiming to show in the brain that this drug works to mitigate or reduce the amount of quantifiable brain injury, which is a very objective way of assessing if the drug is having an effect.
So, Dr. Berman, ReAlta has raised more than $150 million to date. How do you think, or I should say, how do you think about where the company is today, where it is now from a capital and strategy standpoint?
We are in a very unique spot in that we have raised enough money to get us through the important catalysts. That's what any biotech company wants to do. So we have sufficient capital that gets us through this clinical trial, pivotal trial readout, phase 2 trial, as well as we're closely collaborating with the FDA and the agency on a number of things, including surrogate endpoints and the regulatory pathway to hopefully accelerated approval. So that gives us enough leverage with respect to our runway so that we can see the results and we can see how hopefully how well the drug is working. And then we have the optionality to then move to the next steps.
I want to come back to biotech leadership. You said one of the biggest lessons for CEOs is to focus and concentrate on your main assets and avoid distractions. So why is that so hard in biotech? Why is that a difficult thing to achieve?
Because CEOs or leadership, they see bright, shiny objects and they want to put their efforts towards anything that may be efficacious. The problem is that when you do so, you burn capital and you don't put, in small companies, you don't put your dollars where it counts the most. It's like playing football. Do you want to spread your dollars around 4 quarterbacks, or do you want to put most of your dollars on the top quarterback or the backup quarterback and the head quarterback? Well, it's not very dissimilar to a biotech. Here we're putting our dollars on, our Tom Brady or our Patrick Mahomes. That's what this program is. And so I think if more biotech CEOs understood that, then their runways would be expanded and they would be in better positions.
Well, Howard, I can see your football. I love the analogy there. And when you look at ReAlta today, what does success look like over, say, the next phase of the company?
Well, we are going to read out our clinical data imminently, very soon. We're going to discuss with the FDA about our path forward. We are the furthest developed company in HIE. And I don't know of many companies that are even close to where we are. We're even creating the plane, building the plane as we fly it, because this is new uncharted territory in terms of MRI as a surrogate endpoint. And so that's exciting to be sort of at the cutting edge of the regulatory development. But I think that this clinical data and this trial will be pivotal in terms of what we decide to do as a next step. Do we take this and commercialize this ourselves, which we can certainly do? It's not it's a very concentrated number of sites to commercialize it. So we can do it ourselves. But those discussions will happen very soon. And this is could be a very meaningful mission that we're making, not just for ourselves, but for our investors.
Well, we want to thank you. That was really great, very informative. Dr. Howard Berman reminds us that some of the hardest problems in medicine demand both scientific ambition and disciplined leadership. For ReAlta, well, that means focusing on HIE, a severe neonatal condition where families and clinicians still have limited options. It also reminds us that in biotech, the work is never just about the asset. It is about focus, judgment, and building around the needs of patients. I'm Solomon Wilcots. Thank you for listening.